I'm Alex, Welfare Programme Head. Welfare is the Nuffield Foundation's broadest area of interest. Our focus is on research that aims to improve well-being for individuals, families, communities and society. And we think of welfare, or well-being, in terms of living standards across different dimensions, including financial dimensions such as income, wealth, consumption or housing, relational dimensions such as social connections and relationships, and physical dimensions such as mental and physical health. We are interested in the ways in which well-being can be addressed through policymaking or practice at different stages of people's lives, whether in early life or adolescence, during early years in the labour market, and right on through to retirement and later life. Your research might explore the risks to people's well-being and how these vary because of ethnicity, gender, age, or where people live, how chronic health conditions or disability affect people's life chances, and how these risks intersect or accumulate as people age. For example, we have current projects on ethnic inequalities in later life, and separately on trajectories of deprivation at local authority level across the UK. Or your research might look at how risk factors interact with the supports that people may or may not be able to draw on through work, family, community, and the state. You might explore the actions individuals take to support themselves by acquiring skills, managing their health, or saving for the future. On families, for example, we are currently funding a project that examines the impact of the benefit cap and the 2-child limit on larger families. And a research team in Edinburgh is using the Growing Up in Scotland data to explore how living with domestic violence affects children's well-being. We funded several important pandemic-related reports, including one looking at how social cohesion was affected by COVID-19, and another examining the impact of school closures on parental labour supply and family well-being. Both of these increased nationwide understanding of the pandemic, with the latter informing government decisions on the universal vaccination of children aged 12 to 15 against COVID. We're also interested in how societal and economic forces combine to impact on people's well-being. These might be technological advances, demographic shifts, economic shocks, or climate change. We want to know how all of these could affect living standards both on average and for different groups of the population. We have a current project looking at family and community vulnerabilities in the transition to net zero. And a Sheffield team has carried out interviews, focus groups and surveys to capture public views on how their personal data is used. The Economy 2030 inquiry, one of our strategic projects, is examining the impact of economic change on people, places and firms, and how such change might best be navigated. And the Institute of Fiscal Studies Deaton Review of Inequalities, another strategic project, is exploring which inequalities matter and why. Looking forward, we'd like to encourage more applications on the impact of the cost of living crisis on people's lives. And I should mention that we're particularly interested in the intersection of work and family life and how technology affects both. Plus, we also have a specific focus on quality of life in later life. Obviously, this agenda is very broad, and we are very open to any innovative research proposals that fit within it. Your research might therefore address how family structures and dynamics intersect with the world of work. Put another way, how does the challenge of juggling work and family life, including multiple caring responsibilities, affect individual and family well-being? What policies and practices, including employer practices, might improve well-being outcomes? What role does technological change play in the lives of families or the world of work? And how might new technologies alleviate, exacerbate, or shift vulnerabilities for individuals and their families? We want to know more about what it means to live well in later life. As health and personal circumstances change, how do older people navigate different aspects of life? How might systems of care and support be better organised? And how do these challenges play out for people with specific experiences, such as those who are ageing without children, or people affected by a lifetime of multiple inequalities? Across our portfolio, The projects we support involve a range of methodological approaches. One current example uses participatory action research methods to understand children's experiences of place. Another is harnessing administrative and survey data and exploiting the staggered rollout of the automatic enrolment of pensions to better understand overall financial well-being. And the teams we currently fund include a wide variety of disciplines from across the social sciences and beyond, including data science, sociology, psychology, geography, economics, and children's literature. Whatever your discipline, we would like to hear from you.